exam. And we're going to make sure we're properly exposed. Going to take off everything. And go and pull up your sleeves. Take your elbows for me. Or just, that's good enough. Okay, we're going to be, your hands like that. Looking at the dorsal aspect, looking at the phalanges and the nails for swelling and pitting, the metacarpals for any bony deformities, and looking at the carpals, so your synovitis and extensor tendon rupture. And I'm going to pick up your hands here, looking at, just like that is the attitude of the hand, and looking at the position of function. Good. And then you can go and flip over, looking at the volar side, looking at the thenar muscles for atrophy and medial nerve innervation, looking at the hypothenar for atrophy and ulnar nerve innervation, and the palmar fascia for Dupuytren's contractures. And I'm going to start with a range of motion, so I'm just going to have you do what I do. And I'll start with the phalanges and spread them apart. Abduction, adduction, curl them in, flexion, extension. Good. And then the thumb, we're going to do opposition, extension, and abduction, abduction. Good. And flexion, extension, metacarpals and the carpals, flexion, extension, or radial deviation and ulnar deviation. Good. Okay, now we're going to be looking at passive range of motion. And I'm just going to move your fingers here. Flexion and extension. Flexion and extension. Good. And we're going to the metacarpals. Flexion, extension. Flexion, extension. And I'm going to move the wrist here. Flexion, extension. Good. Flexion, extension, sorry. Okay. I'm going to palpation, so you can just stick both the hands like this. At the same time, I'm just going to do the one side. Down the phalanges, down to the metacarpals. Okay, the first one. All right, the base of the first one, we are going to feel the trapezium. And then the anatomical snuff box in here, feeling the scaphoid. And then in the base of the third, back down, we're going to feel capitate. On the base of the fifth here, we're going to feel the tracheatrium and the triangular fibrocartilage complex. Okay, go and flip back over. Okay, back over here, we're going to feel the scaphoid again. And on this side, the pisiform. Good. All right, now you can just have your hands flat like that. Perfect. We're going to check the motor. So what I want you to do is flex this joint right here. I'm going to hold the other ones. Good. Oh, sorry, try that again. Good. Okay. And we do it bilaterally, but I'm just going to do this. And so now I want you to flex at this joint. Good. Good. Okay. And now go ahead and spread your fingers apart like that for abduction. I'm just going to resist. Okay, and then put them together. I'm going to try to pull them apart. Good. Now put your thumbs out like this and push down. I'm going to pull up. Good. And do a grip strength test. Good. Okay, now hold out your wrist like this and resist again. Then I want you to push down against my hands. This is flexion of the wrist, checking C7. Pushing up, extension of the wrist, radial nerve palsy in C6. And for go to the sensor, you're going to do dew point discrimination. So I'll have you stick your hand like that for me at first. Close your eyes and tell me when you can feel, if you feel 1 point or 2.
2.
Oh.
2. 1.
Good. All right. Roll your hand over for me. We're going to do this bilaterally, going side to side.
2. 2. 1.
Good.
And what are you checking?
Oh yes, we are checking the first one for the thumb. The dorsal aspect of the thumb was checking the radial nerve in C6, and the palmar aspect of the third is the medial nerve C7, and now the palmar aspect of the fifth, checking the ulnar nerve, which is C8.
2. 2. 1.
Good. Okay. You want to roll your hands back over and check capillary refill. Yep, that's diminished on that one.
Ow.
Sorry.
Okay.
And then we're going to check all those. And now for the special techniques, we do Finkelstein's test. So I'm going to have you stick your hands up like this, tuck your thumbs in, and then rotate them forward. And this is testing D. Quervain's tenosynovitis. And we're going to do the grind test. And so I'm just going to have you relax here. I'm going to grind this right in here. Oh, that's right. You have the Okay, good. And that's for pain and arthritis. Then we're going to check the ulnar collateral ligament. So just go ahead and stick your thumbs like that for me and tuck them in close. Good. Okay, and this. And then we're going to spread this joint apart. Good. And now for carpal tunnel, we're going to do the phalanx. So I'm going to have you stick both your hands like that. We're going to hold that for 1 minute. Check for any numbness. Put your hands out. The Tennell's test. Just going to tap. Any pain? Looking for any shooting pain into the hand. Then we're going to do the compression test. We're going to hold that for 1 minute. Good. And if all these were negative, we're going to do a shoulder and C-spine test or exam.